Hello and welcome to the Amyloidosis Research Consortium's ARC Talks webinar series. We're delighted today to be hosting a webinar that's specifically for caregivers and a guide to self-care. Caregivers are often overlooked in the medical journeys that patients go through with amyloidosis, and they really are a key part to the successful experience that patients have and really need to take care and look after themselves. I'm really delighted to welcome today to speak Nancy Verel, who is a nurse and caregiver herself to her husband, who has AL amyloidosis, as well as Robert David, who is the manager of cancer support programs at Boston University Medical Center. And he also, as many of you may have met him if you've been to Boston, he facilitates the weekly amyloidosis support group program there. Welcome, and I'll hand over to Nancy to start. Thank you, Nancy.
Hi, Isabel. I'd like to thank you for this opportunity to share my role as a caregiver, a nurse, and a wife to my husband, Marty Varel. So my name is Nancy Varel, and my husband, Marty, and I have been married for 37 years. We are the parents to 4 daughters, mother-in-law to 1 son-in-law so far. I'm a nurse at the Cleveland Clinic, where I work in a family health center in internal medicine. And I would just describe myself as a friend, a neighbor, and a person of faith. So within all those titles that I give myself, many other caregivers become part of what brought us to this day. Our daughters were and still are active in their dad's care, although it varies vastly from day to day and month to month. We can teeter between emotional and or physical care to no obvious need for care at all. But one thing is for sure, we are a changed family. 2 of our daughters are RNs at the Cleveland Clinic. They work at the main campus in the emergency department, so that's in downtown Cleveland. Our oldest daughter is married, and she works in accounting. Our youngest daughter just finished her freshman year at college in New York State. We are a family that likes to be together. However, being together, knowing dad is being drilled into, biopsied, poked, injected. We've held basins for him when he's vomiting, when he's been hallucinating. We have stayed with him overnight. These were not things that were part of our plan, but as a family, we pulled together and we worked out a plan to help him through those times. For myself, being a caregiver to a very unhealthy husband was the furthest thing from the ideal life we were living. In the fall of 2015, my husband became a retired physical education teacher to special needs children. He was 54, had exactly 30 years in teaching in the same system in Cleveland that they forced him to retire. 30 years and done, basically. It wasn't in our plans, but the next big life event was going to come quickly. I was working part-time as a nurse in a different family health center than where I am now, but I was in family medicine, and Marty was a patient in our practice. He came in at the convincing of one of my daughters and myself, who noticed he had very swollen feet and ankles. We noticed this on a family movie night in our family room when he had the recliner up and his legs up. And my daughter Megan and I started swapping pictures we were taking on our cell phones and sending them to each other, remarking how swollen they were. So he came in, he had a visit with one of the physicians. He had lab work done. The labs were very abnormal. The most striking lab was a cholesterol of 524. They redrew that, it remained the same. His kidney functions were out of whack as well. Then, within a few days of that, he developed a case of the shingles. So it was a second doctor that caught on immediately to this whole series, very quick series of events, and made arrangements for him to see nephrology at the main campus of the Cleveland Clinic immediately. That was when we first heard the word amyloidosis. Many painful tests, hospitalizations, and more painful tests would render the diagnosis of AL amyloidosis, but he would also need dialysis. So he was in the hospital at that point. Overwhelmed, we were walking by our faith at this point because in the learning curve was just huge. We weren't comprehending everything. Marty processed things much better than I did. Perhaps I just had tunnel vision and was stuck way back when he was beginning to see nephrology for what we thought was a nephrotic syndrome. There were many, many hurdles along the way. The details I won't go into, but they would demand me to wear many caps at the same time. As his nurse, his wife, and his caregiver, he was very sick now. Every time I would take one cap off, someone would creep in and give us worse news. On one occasion in the emergency department, the doc told him he had multiple myeloma. Another occasion occurred at dialysis when he was told his acute kidney injury was permanent, no chance of ever coming off dialysis. Well, that may have ended up being true, but his own nephrologist and hematology oncologist held out hope that he might recover enough function when the amyloid cells were gone that kidney function would come back. We opted to stay away from a dialysis center. He went for about maybe 6 to 8 months, and the headaches were just a level 10 all the time. And then he'd come home from dialysis and that headache would continue until the next day. So we opted to do home hemodialysis in a much more controlled, clean, trustworthy environment, being our home. I would be the one administering the dialysis, only I was quickly overwhelmed when I needed to train for my part of my husband's home care tech position, which was going to be me. It proved to be extremely difficult. So our oldest nurse daughter, took on the task. Marty had trained for weeks on the machine, setup, starting, ending, treatment, and what to do if his blood would need to be returned to him. Now he would be the one getting it, but he still he absorbed this stuff. He's a very easy and quick learner. I did eventually learn, and all those evenings I would sit with him in our once library turned dialysis room, where I would rather not have been, but that was where we found ourselves at least 4 evenings a week for 4 hours. Being home allowed him the comforts of home with less chance of being exposed. And it allowed him to have friends to come in a dialysis center. Nobody goes back, not even the wife, caregiver, nurse, in my case. At home, it was nice to be able to let friends come in while he was receiving a treatment. It would allow me to be able to walk away, but it was good for him. You know, everybody would have to don a mask, but their visits were priceless. Less than a year after starting home dialysis, I had to take on full-time work as we were beginning to see in the future a stem cell transplant and possibly a kidney transplant. We needed the best health insurance the clinic offered with the least amount of cost. We also knew with those 2 surgeries could come very high expenses in drugs, in the kidney, anti-rejection drugs. So I took on a full-time position, and our daughters, I took on a full-time position at the Cleveland Clinic, and our daughters started to help with dialysis. I actually would pay them $50 a treatment just to give me the relief of not having to rush home to do a treatment, and it helped them to get a little bit ahead financially. It was just a relief for me. It was just too much for us all, but mostly me. It came to the point where I just had a hard time poking my husband with 2 14-gauge needles that were attached to his dialysis catheters. And that's, how the dialysis went. It's how it functioned for him. That's where the blood flowed in and out of those huge needles. I just got a weird anxiety towards the end, and I just found the whole thing to be exhausting, demanding, and just daunting. And it just came to a point where I couldn't do it anymore. So he went back to a dialysis center. At that point, we had a new one in our area, and it functioned very well, and it was just the perfect place for Marty to be in the perfect time. So Becky went there, and then we were well on the road to planning and preparing for a kidney transplant. But I want to share that in that time when we were home doing dialysis and just, throughout his illness up until that point, so intertwined in our daily lives were friends, people from church, friends, neighbors. Marty was a soccer coach, and so he had many team players, families. We just had visits like crazy, meals that were just so perfect and appreciated. He had visitors from his job that he had just retired, or that he was retired from, and we had pastors visiting. So all in all, it was wonderful. In particular, I remember the soccer teams coming over. JV would come separate from varsity, but both those occasions would bring about 15 girls. As if we didn't have enough girls of our own, but there's never too many girls around here. They would come, we would order pizza, they would sit around the table, and they would tell Marty everything, from colleges they were choosing to, I don't know, all the gossip in the high school. We live in kind of a small town, so, but it was so good for him. The laughter was truly medicine for his soul and for actually all of us. I kept a caring bridge very early on in our journey. I updated it often with Marty's status, current treatments, as well as explanations and prayer requests. So much could be conveyed through that site. Something that we did for ourselves was taking biannual trips to Florida, staying oceanside, as to just enjoy the vast, amazing, and majestic ocean. It was therapy for us all. Even the car ride from Ohio to Florida and back proved to be medicine for us all. The laughter truly was the best medicine. One of the many little blessings happened when Marty went for dialysis while we were on that Florida vacation in Melbourne. He went to a very foreign, unsettling situation where nobody is familiar with him, or he needs to have dialysis done. And, if God didn't provide a wonderful tech that not only had a husband with amyloidosis, but was also treated at the Cleveland Clinic, that was just a wow moment. And without any request, during our next trip to Florida, he would run into that same tech. God always provides, always. When I, the nurse, wife, caregiver, didn't want to trust that he was in safe and capable hands, he was actually in perhaps better hands. 2 weeks after that vacation in 2018, he would receive a kidney transplant. Our second daughter, Megan, was his donor. A beautiful day indeed. As Marty's wife, caregiver, and nurse, I was most often in uncharted territory. The wife role was the easiest, for it just called for me to be there, supportive at all times. The caregiver role, however, had me digging for information, drugs, other opinions, treatment sites, as well as possible outcomes, good and bad, all while keeping a positive outlook, especially when I wasn't finding the outcomes I was looking for. Amyloidosis was going to be like an ongoing adventure without a map and without a foreseeable end. Today, our hiatus will be ending soon as his numbers have increased and are out of range. You know, that kappa lambda ratio. The very lab we hold our breath for every month. He will be back at the Cleveland Clinic, Taussig Cancer Institute for Cyborg every 5 weeks, along with a clinical trial drug. As his wife, I will be there with him. As his nurse, I will watch closely to avoid any unplanned outcomes. As his caregiver, I will keep him safe and protected. So, if I had to summarize the past 5 years, I would say the strategies that have worked well in our 5 years of AL amyloidosis journey have been approaching every hurdle together as a family, being present. We are all involved attending appointments, celebrating milestones, and everything in between all that. Taking time out, that Florida trip or even holiday trips to a mountain getaway in West Virginia were needed. Appreciating the caregivers, doctors, nurses, every one of them. They love treats, wine, donuts, cookies, but they do need to be appreciated. And then sharing our journeys, ups and downs via Caring Bridge. Feel free to check it out.
Thank you so much, Nancy, for a really personal and moving story, and so much to be learned from your experience. I'd like to welcome Bob and to hear from his side of the experience of moderating these support group meetings. And he's come across many amyloidosis patients and really knows what we go through both as patients and caregivers. Welcome, Bob.
Well, thank you, Isabel, for this opportunity to give a presentation. And I want to thank Nancy for really just giving us a heartfelt rendition of her experience caregiving for her husband and the experience that her whole family has endured. She's very fortunate she has all those daughters to help out. And, you know, the caregiving journey is different for everybody. It's really a unique journey for everyone. And what I'd like to do is just give a presentation that covers some basic points and some points that I find don't always get brought up or discussed. My job at Boston Medical Center is as a manager of the cancer support programs. So we have a variety of support groups and activities and other programs primarily for our cancer patients. But I also run our weekly amyloidosis support group. And it's really a privilege for me to do that because, you know, it's just a variety of wonderful people. As you know, a lot of amyloidosis centers have people that come quite a distance, and they come for evaluation and diagnosis, and then they return periodically over the years. So in my case, I get to see people, a different group every week, but a lot of the same people, maybe 6 months or 12 months later. So it's wonderful. And it's the groups generally have patients and caregivers. And my general approach is that we want to learn the specifics of everybody's experience, but we also, you know, in terms of the physical effects of amyloidosis, but also the emotional, social, and mental experience that everyone has. So anyway, what I'd like to do is start by reading an adapted version of the preface to the American Cancer Society Caregiver Resource Guide. And so I'll read a few paragraphs of that and then say a few more words about my own personal philosophy and then go into the caregiving points. So let me begin. What does it feel like to be a caregiver? Despite the sadness and shock of having a loved one diagnosed with a serious long-term illness that may require treatment, many people find personal satisfaction in caring for that person. You may see it as a meaningful role that allows you to show your love and respect for the person. It may also feel good to be helpful and know that you're needed by a loved one. You might find that caregiving enriches your life. You might feel a deep sense of satisfaction, confidence, and accomplishment in caring for someone. You may also learn about inner strengths and abilities that you didn't even know you had, and find a greater sense of purpose for your own life. Caregiving can also draw families together and help people feel closer to the person who needs care. Caregiving can also be frustrating and painful. People caring for very sick patients may notice their own feelings of severe sadness and emotional distress. They may feel sadness and grief over their loved one's illness and may also feel overwhelmed or frustrated as they try to manage many difficult problems. Caregivers can develop physical symptoms like tiredness and trouble sleeping. This is more likely to be a problem for caregivers who aren't able to get the support they need and who don't take care of themselves, especially those who try to press forward alone, even as their own quality of life suffers. Caring for someone going through treatment for a serious long-term illness can be demanding, but being good at it can give you a sense of meaning and pride. These good feelings can help provide the strength and endurance to continue in the role for as long as needed. So let me just add something a little preface on my part. So for the remainder of this webinar, I will be discussing important strategies for optimizing the caregiver experience, hopefully to benefit both you and the loved one you are caring for. I recognize that people tuning in may be at different time points in their caregiving experience, so I want to offer the following reassurance, or assurance, let me say. I'm of the mind that it's never too late to try to correct a situation, to improve communication, to stop an unhealthy or unproductive dynamic and replace it with something more gratifying. So, wherever I suggest that you be proactive about something early in the caregiving journey, that does not mean you cannot achieve beneficial results by altering the course later on when you sense problems may have already arisen. So the first topic, communicating. You will likely want to accompany your loved one as much as possible during initial testing and diagnosis, and then through treatment and follow-up. Throughout this journey, it will help you both to be fully communicative. Be open and direct with each other and with the medical team about your understanding of the disease, the diagnosis, the recommendations, the treatment, and the prospects. To do your job as caregiver most effectively, it's best to be clear on exactly what your loved one wants throughout every step regarding treatment and support. Continue to check in with them to be sure you are not missing anything and to keep the door open to further requests. At the same time, communicate your own limits early on, not in reaction. You want the patient to maintain realistic expectations of you. When the patient is feeling very bad, they may be able only to focus on their own needs and expect you to take care of everything else now. It's easy for small resentments to start to build. This is best averted when the pattern of communication is fluid and open. This will also lead to more collaborative decision-making and working better together as a team. It will also make it easier for both to express and discuss more difficult feelings as they arise. Self-care. So I'm going to start with what is probably very obvious, but as I continue on, I think there are going to be points that are not so obvious. Physical self-care. This is the most obvious point. It's easy to start neglecting one's own physical needs when caring for someone who is sick. But it's very important that you eat well, get good sleep, get fresh air, exercise, relax, maybe meditate. You are usually more prepared, in a better mood, and better able to care for someone else when you feel good physically. Emotional self-care. Typically, throughout this journey, people will ask you how your loved one is doing. How is she handling this diagnosis? How are the treatments affecting her? Now that the treatments are over, is she getting back to normal? How does she feel not being able to go back to work, etc.? Much less frequently will you hear, with all the extra things that you now have to take care of, how are you doing? Just as one can never know what it actually feels like to have a severe chronic disease like amyloidosis unless you've gone through it yourself, one cannot appreciate the demands and stress of being such a patient's primary caregiver without having had a similar experience. Therefore, it is important to keep in touch frequently with friends and other family, and to be open about what you are dealing with. Sometimes you'll want to vent, and sometimes you'll find that you can calmly explain. You will quickly discover who listens better and who doesn't, who tunes into your concerns better and who doesn't, and with whom you thus can feel more comfortable sharing details and feelings and thereby feel supported. It's important to build a network for your own care. Even having one or two others who check in on you regularly or whom you can always call can be vital to your sanity and emotional well-being. Consider also attending a support group. If it's an amyloidosis support group for patients, usually a number of caregivers are there. It always helps to hear the experiences of others and to have an opportunity to share your own. You feel less alone, and participants usually find ways to laugh in the group. I can't speak so much for other groups, but in the weekly support sessions I run, you will hear the patients' histories in terms of their amyloidosis journeys. You'll hear how each patient deals physically, emotionally, mentally, socially, and/or spiritually with their situation. You'll hear how each patient views the future and how each caregiver views how the patient is doing, and what the journey has been for each caregiver. And you'll hear laughter and reaching out towards one another. You'll leave such a session with a much broader picture. If you can't find a local group or a group specifically for caregivers in your area, there are resources online. Getting personal space. Make it a point to get out of the house regularly, even for brief walks, or at least frequently get distance from the patient inside the house. If the patient is in such a state that they cannot be left alone at all, then you definitely need some help so that you can get personal space. And we'll get in the next section to getting help. You will be spending more time than usual with the patient. Most likely the patient will want space from you as much as you want space from them. Maintaining hobbies and social events, the social activities as best you can. These are an important part of your psychological health. It's vital to put your attention on other things that are less stressful and more relaxing whenever you are able. Perhaps you have a standing Friday lunch get-together with one or more friends, or you have a daily stretching routine that makes you feel good, or you have a knitting or woodworking or internet project that gives you a sense of accomplishment, or you have a favorite TV show or a list of funny movies that help relax you. Maintaining as many of these different types of activities as you can will contribute to the peace of mind of both yourself and the patient. You are doing this for both of you. It's possible that your loved one will feel a bit jealous or left out at times, but it's more important that they see that they are not overburdening you. Balancing your time. Be realistic about time limitations and plan things accordingly. Your loved one's illness is a major element in your life now. Though it should not be all-consuming of your time and attention and energy, it is going to require a lot of it. You may want to make schedules that include tending the patient's physical needs as well as your own needs as described above, plus the needs of other family members you may be responsible for. Of course, if you are working or are a student, you must plan for the patient's needs to be taken care of while you are away. Preparing mentally for the long haul. Remember the long perspective. Much will happen over the days, months, or years to come, and one can hardly predict how these things will go in all their intricacies. Whenever things begin to feel overwhelming, remind both the patient and yourself to take things one day at a time. We'll get through this. Let's just focus on what we need to do right now. Acceptance. It is so much easier and healthier for the patient and for you if they accept the reality of having this disease and can embrace or approach the challenges ahead in a positive and proactive way. Similarly, it will lighten the sense of being a burden that the patient will likely feel if you truly accept your role as caregiver and all the accommodations that you will have to make. The hardest part of any difficult situation is usually the unknowing. Once things reveal themselves and there is more information and more understanding, people find the will and the way to deal with the situation effectively. Our own life experience shows us this. Yet we get anxious when thrown by something like a new diagnosis. We are all stronger by far than we tend to give ourselves credit for. And very rarely does life turn into a complete horror show. Your reflection upon and acceptance of these facts, plus whatever comfort your own personal faith offers you, are things to turn and return to in order to allay the doubts and worries that may try to consume you during your caregiving journey. Professional help. It's possible that you have been in the caregiving role for a while now, and you are in fact feeling overwhelmed and down a lot of the time, with little energy, perhaps crying easily or quick to anger. You may be overcome with a sense of hopelessness. You may have become depressed. This is not uncommon for caregivers. Do please to continue to follow along on the points to come in this presentation with as much of an open mind as you can muster, because you may develop some insights. Remember, I strongly believe that it's never too late to change and improve a bad situation. You may find even one suggestion that, if tried, can change a difficult dynamic, which in turn may lead to other things falling into place. But if the sense of hopelessness prevails, it may be time to seek counseling with a mental health professional. Help. Accepting offers of help. It's very important to accept offers of help right from the beginning, even when you feel you can handle everything yourself. People like to help. Opportunities to do so build their self-identities as good people who help others. But people often don't have opportunities to help others, or they don't know how to offer or what to offer when a situation does present itself. So when it's known that your loved one is sick and the impulse arises within someone indeed to offer help, never dismiss the offer lightly. Very often, an offer of help that is not accepted at the beginning is not made again. And it's later on when you will likely most want and need help. You don't have to accept all offers, but do accept some, especially from those individuals you feel will be reliable. Later on, you will likely want more help. If these people know how to truly be helpful, and they come to feel they are even a small part of the caregiving team, then you will have important, lasting allies. Asking for help from family members or close friends. Always one person, probably you in this case, takes the lead in the caregiving of a patient. If there are 4 children all living near and equally available to a patient who is their parent, such as in the case of Nancy, and she was so fortunate really to have those 4 daughters available and willing to take turns helping. But still, one person inevitably will still take the lead and do the lion's share of the care. Often this ends up feeling unfair. If you are the spouse or you are the only one available to take on the primary caregiver role, it still behooves you to learn to ask for help effectively before resentment sets in. but it's never too late to make an effective request. Give thought to how you will ask. No matter whom you are asking, try to remove any sense of expectation, obligation, or guilt tripping from your request. You may begin with a calm, "I'm calling to see if you can help me." Then take your time, explain realistically and in detail what you are dealing with, what the needs are, and how specifically you could use help. This makes it easier for the other person to listen, understand, and respond thoughtfully. And it becomes easier for you to accept the response, whatever it may be. Even if the person is not able to help you now, you'll be glad at least that they understand better what you are going through. And you may find that they turn around and offer help later. Setting up local services. There may be free meal delivery, grocery shopping, or light house cleaning services available to you. Often there are organizations that provide respite, caregiver, or visiting companion services. All of these can give you much needed temporary relief. It's a good idea to set these up early before you start wishing you had help with these things. But you can still do this anytime. It's a matter of a little research and a couple of phone calls. Setting a boundary. The patient will likely at times, and maybe often, feel cranky, edgy, impatient, not themselves in general. Many factors may contribute to this. Physical issues, including aches and pains, soreness, labored breathing, fatigue, weakness, dizziness, queasiness, neuropathy, which we know as reduced or uncomfortable sensations in hands and or feet. Emotional challenges like depression, grief over the loss of normal functioning, anxiety, frustration, boredom, apathy, feeling out of control, feelings of powerlessness or inadequacy, lack of libido, reduced or impaired cognitive functioning such as forgetfulness, lack of concentration, lack of reasoning ability, or spiritual crises, perseverating on such questions as, why me? Will life be worth living? What will I do if I can never work or function normally again? What value am I to my family? Will I just be a burden? Understanding the above and remembering why the patient is lashing out are helpful in realizing the problem is not you. You are just the easy target. But the lashing out, the diatribes, the disparaging comments can become all too much. If and when it starts to feel this way, it's a good idea to protect your feelings and peace of mind by gently removing yourself from the space. A simple, straightforward, "I'm leaving the room for a little while," which you then must do, protects you. Let me explain how it also protects the patient. If tensions and anger rise and you end up arguing, the patient will later feel guilty because they know you didn't deserve the harsh words. And they don't need guilt to compound how badly they already feel about themselves. They, of course, will later apologize to you. But now you and the patient have set up a bad dynamic that is very likely to get repeated. If the patient knows now that they can lash out and then make it better by apologizing, then the lashing out becomes legitimized, along with the subsequent guilt. It's now a proven and safe way for the patient to affirm and stay in their misery, and the guilt confirms how miserable a person she or he is. Better to avoid all this by setting up boundaries at the beginning or as soon as you can. The following may be fully or partially spoken, but all the better demonstrated to the patient. I understand you don't feel good in a number of ways. I know it's important for you to talk about this, and I will listen to you. But if you start to blame me, I will leave the room. Respecting independence. One of the biggest sticking points around caregiving, one that few caregivers succeed at managing well, is allowing the patient to maintain a sense of independence. This is a deep concern because it also involves issues of respect, trust, confidence, self-esteem, and dignity. You will invariably find yourself in the position of wanting the patient to eat more or drink more or do less. Harder still is when you want the patient to be more active. Of course, you are looking out for the patient's health, and you feel strongly that your loved one should always do what the treatment staff have recommended or prescribed. As many of you have already experienced, these situations arise continually, and you wrestle with how insistent to be and when to back off. Almost inevitably, both you and the patient come to feel you are nagging. Over and over, you both get frustrated. This is unhelpful both to the patients coming to terms with their condition and to your peace of mind and satisfaction in being a caregiver. Please remember that healing is the patient's job. It's their job to manage their disease and its effects, and your job to assist. You may volunteer to take on certain responsibilities, or the patient may delegate them to you. The list of responsibilities, both old and new, is huge. Keeping track of appointments, making travel arrangements, managing the medications, keeping up with the insurance, preparing the meals, taking the kids to school, etc. All this is best discussed and agreed upon early. Nutrition is a huge factor. Review and discuss together at home all the provider's recommendations to be sure they are clear, acceptable, and doable to both. After that, it's the patient's responsibility to eat and drink accordingly. When it becomes difficult for them to follow through, your message can be, I know you want to get through this meal. I know it's not what you feel like doing right now. Is there anything I can do to help you? The patient already understands why she or he should eat this certain amount or get such and such amount of fluids in them, so no need to remind them. Some gentle encouragement is fine, but be prepared to let it go if they are just not up to it. Maybe the next meal will go differently. Tomorrow's a new day. Missing a few ounces of this or that at this moment will not make or break your loved one's recovery or health status. In doing the above, your implied message is this: I respect what you are going through and how you feel. I know that you truly desire to get better. Even though I am encouraging you to eat or drink more, I'm going to trust that you know better how you feel right now. I have confidence that overall you are on the right track. Further, your message is saying, I am not going to try to make decisions for you. You are competent to make your own decisions. In addition to avoiding an argument and all the negativity that goes with it, this allows the patient not to feel bad or guilty for truly not feeling like eating or drinking. It also raises the expectations for both of you that the patient is going to take care of themselves. Everyone wants to feel competent and to feel trusted to handle certain responsibilities. This is a very supportive message. It also means the patient may well approach the next meal with less dread, more positivity, and greater likelihood of success. Physical activity. Certain types of treatment and their side effects often largely incapacitate patients. Hard and uncomfortable as it is both for patient and caregiver to go through treatment, the standstill of regular life activity is usually accepted. The treatment and everything it entails takes utmost priority. Most everything else, unless involving the needs of young children, special needs individuals, or elderly adults requiring care, gets put on hold. Yet, as the treatment regimen and management of side effects become more routine and comfortable, and especially after the treatments have ended, your loved one may become impatient with being sedentary. She or he may grow anxious to get back to doing things they have always done before. As the patient starts to feel better, there is, to some degree, a resurgence of energy all over, including in the mind. Everyone knows how good it feels nearing the end of having the flu or even a cold, finally to feel a bit of normalcy within oneself. You may feel better and bounce up from the chair, only to suddenly realize, whoa, I'm not as healed as I thought I was. And then you sit back down, or you continue to move about, but more subdued than you'd anticipated. But you had to get up from the chair to realize this. No one can know the limits of one's body better than oneself. Your loved one wants desperately to get back to normal. She or he has suffered a major life setback, yet they realize they're on the road to recovery. They don't know the limits of their body at this point, and they are ready to test it out now to find out. Every ounce of success in doing this is a confidence builder. It's the normal tendency for the caregiver not to want the patient to overdo it. You want to put the brakes on. You feel the activity will be too taxing or risky. Yet the patient is wise enough not to push too hard. They will approach the task, whatever it is, with care and some degree of trepidation. If they do hit a wall, they know it right away and they stop. And now they are clear on the current limit, and they are happy to have made the effort. The same principles discussed above regarding the caregiver's sensitivity to the patient's need for independence apply equally here. Your concern for the welfare of your loved one is genuine. You don't want them to hurt themselves. Yet I encourage you to step back a bit and recognize this part of your loved one's healing. Show your concern in a gentle, understanding, accepting way. So, when your recovering husband says, "I'm going to mow the lawn," your message can be, "Are you sure you want to do this?" "Yes." "Is there anything I can do to help?" "No, thanks." "Well, okay, just please go easy. And if it's too much or you get tired, you know you can just stop. And please call me if you need some help." Whatever the situation is, and whoever the patient is, the same principle applies. You get the idea. Respect, support, and trust the tremendous drive towards self-competency, independence, self-worth, and dignity. This is a huge factor in the total picture of your loved one's healing. Note that when this drive is lacking and your loved one shows little motivation to move forward, when you recognize that they could now do more for themselves, they may be depressed and really questioning their self-worth. Rather than pushing them and generating more resistance, better to show understanding and gently encourage and elicit their agreement to go for professional counseling. Maintaining or building your relationship. Particularly if you are the spouse or a younger adult caring for a parent, though generally this can apply in all cases, you still have certain emotional needs that the patient may have fulfilled for you for a long time. You want the patient to maintain that role for you as much as possible. This may have all the more meaning for both of you at this point. It will bolster the patient's sense of worth to feel that, in some instances, she or he can still be the strong one, the one you can depend on for some important things. For you, they can be tender moments to relax into a reversal of roles and get taken care of. You may want to look for opportunities to create this kind of situation. Here's a simple way to do this, especially when you are tired or strung out. Ask the patient to give you a hug. Here are some other ways to maintain a good balance. Include your loved one in your decision-making processes, even when you don't feel it's necessary. You make it a point to ask the patient's opinion or advice. You can think out loud so the patient feels comfortable interjecting their input. If the patient is suffering treatment side effects and their cognitive functioning is off, you can slow down, be more patient, refrain from finishing their sentences for them, and listen harder. After all, you've known them a long time. You know how they think and how they express themselves. Having all the words said aloud may not be necessary. You may also pick times when the patient is feeling pretty good to suggest doing some simple activities together that you used to do, or even plan ahead together so you both may have something to look forward to. Just be sure to keep the plan simple and keep your own expectations down, because your loved one may not be up for it when the time comes. Another idea is to reminisce together, and this can be done a number of times over a long period of time. Recall the many good times you've had together. Recall the many good things that your loved one has done for you over the years. Review your history together, even the rough moments. Expanding time like this helps put the disease and the current situation in better perspective. Things change, but this doesn't erase all the many things that you have experienced together. This is an affirmation of the relationship and the bond. Reminiscing in this way can bring some peace, greater acceptance of the current situation, and maybe increased hope. It may also bring sadness and tears to both of you. Shared grief is a very bonding experience. To acknowledge that the past has held things that may never be there again is to recognize loss. To do this together while really being together, sitting close, maybe holding each other, feeling these feelings together, this is a step forward in the relationship. This is a deep experience of sharing that should bring you closer and only increase your love and appreciation for one another. Well, that concludes my presentation. I know there are many experiences and points about caregiving that I couldn't include here, but hopefully many of the points I did say will hit home for a lot of you, and I hope they're helpful. So thanks for your time and attention. May you find the silver linings throughout your caregiving journey. And if you're interested in a write-out of what I just talked about, you can contact me at the email given, robert.david@bmc.org. Thank you.